little sting, and then look forward to chatting.
Great.
Sure, it's nice to be able to catch you again after the great interview we had. Sure, it's only a week ago, Ryan, where you said we definitely into the third wave. I think nobody can doubt that now. Gauteng is creaking.
Unfortunately, Alec, I wish it was otherwise. I wish I was wrong a week ago. But we're seeing infections, new daily infections, 30% above where they were in the prior peak of the second wave. So we haven't seen the likes of these infection numbers in Gauteng before.
Why has it been so much more virulent than in both the first and second waves?
Well, our view about Gauteng is that, in fact, it was one of the least affected provinces. On our estimates, about 45% of Gauteng had been previously infected with COVID-19. Whereas if you compare it to the Eastern Cape, for example, our estimates were 90% plus had a previous COVID-19 infection. That means that underlying immunity in Gauteng is really absent. There are no antibodies through previously infected people. And so we think that predisposes Gauteng potentially to a very bad wave. We said this before the wave began, and unfortunately now it's proving to be correct. I think the scary part, Alec, is that hospitals are quite full already. And the hospital admissions tend to follow about 2 weeks after the infections. And with the infection numbers we've seen the last few days, we're very worried about what happens in the hospitals 2 weeks hence.
So 2 more weeks into the future before things might start turning down.
Well, yesterday, if I remember correctly, there were 13,575 new infections reported in the country, of which 68%, a very high proportion, were in Gauteng. And so just yesterday's infection numbers, the proportion of people from yesterday that will land up in hospital is about 2 weeks from now.
Ryan, just before we go more deeply into the Gauteng figures, the Eastern Cape presumably then is not going to be looking at a third wave. Are there other provinces that will also escape this?
I've learned one lesson, Alec, that it's extremely dangerous to make predictions about this disease, which is unpredictable and which surprises us around every corner. So how I would put it is to say that if the Eastern Cape does experience a surge, we think it will be much lower than wave 2 and that it will be a more manageable surge. Again, we do not have a crystal ball, and it's not proven possible to predict how this disease unfolds. The Northern Cape was interesting. It went through a terrible third wave, but it's on the way down the other side now, reducing daily infections. And that's quite reassuring. Northwest seems to have also potentially reached the peak. And that's looking good. Limpopo has had a terrible third wave and is still on the way up. KZN had a very high infection level, in our view, from previous waves, where we put the Eastern Cape over 90% and Gauteng below 50%. We had KZN round about the 80% mark. So we think also potentially protected against a severe surge, but it is a large population and relatively densely populated. So we'll have to wait and see.
And in the Free State and the Western Cape?
Free State seems also to have peaked in this wave. We're hoping that it's on the way down. Western Cape escalations have been quite high over the last few days. We positioned their previous infections at about the 60% mark. What that means for us is that it's quite difficult to predict because it's on the edge of that so-called herd immunity threshold. And so we think there is some risk in the Western Cape, and all over the country, people should be very cautious, but particularly we think Western Cape and Gauteng at the moment, yes.
Ryan, from Discovery's point of view, you've got millions of members. Some of them are going to get very sick from people in Gauteng. Would you advise them to get in a car and drive to perhaps Durban or even the Eastern Cape to get into a hospital there if it's going to be so difficult to be admitted here?
No, in fact, I would advise them to do the opposite, Alec. I mean, interprovincial mobility is a huge problem because we do end up just seeding the infection all the way down the path that we take the route that we take to wherever our destination is, and there too. The strong advice, and I couldn't be more firm around this, is to stay home. It's, to lock yourself up in your home, pretend that it was that same period of level 5 restrictions again, try and do all your shopping online, and really confine yourself to your home until this settles for at least a couple of weeks. I think given the economic pressures in the country, the government may not be able to enforce a level 5 lockdown. They may choose to, but I think it's a very difficult decision with that tension with the economy. And so we should, from a behavioral point of view, try and give effect to it nonetheless.
I've noticed with a couple of friends who've really got themselves into, well, not got themselves, they're in difficult situations, that they had sniffles and then they didn't think it was serious. Is that one of the absolute signals that
Common
it,
feature. Yeah, absolutely. Nasal congestion, a scratchy and itchy throat, sore throat, low-grade headache, feeling of malaise or fatigue, just a little bit of tiredness that's quite unusual for you at an unusual time of day. These are the early onset features. I wish they were more severe, those early onset features, because people could then recognize they're ill and isolate immediately. But as you allude, many people seem to carry on, ignore it, think it's a bit of hay fever or a common cold, and it turns out not to be.
yeah, certainly, and especially at this time of the year as well, it's very easy for them to suggest that. But we've got that message loud and clear. What about people who are COVID-19 positive and they are at home and don't want to clog up the hospital system? What can they do to ensure that they don't need to go into the ICUs?
Well, the good news is that the vast majority of people have a completely asymptomatic or very mild infection. And that is extremely reassuring and good news. This is largely a disease, particularly in the young and the healthy, which doesn't manifest in severe symptoms at all. Unfortunately, in the elderly and those living with chronic illness, there is indeed a lot of risk. We see, of all the positive infections that we've seen at Discovery Health, to date, we've seen about 250,000 of our members testing positive. We see a 20% admission rate to hospital. And it's quite predictable who gets admitted. It's unfortunately the elderly and those living with chronic illness, particularly more than one chronic illness. Your question is what they do if they're at home and they're sick. Consult your family practitioner as a starting point. This is a disease that is very well managed at the moment by the general practitioners. They are the primary givers of care here, and they have come up with what the evidence is showing quite reliable cocktails which they're using to treat COVID-19 at home. So I would start by engaging with your family practitioner. We suggest you do it on a virtual consultation across our digital platform available to our members through our website. You can talk to a GP on a virtual consultation by telemedicine. That means you can stay home and stay isolated, and your GP can be protected. And then your GP will discern whether a further examination and assessment in person or blood tests and the like is needed. And then there are various remedies that can be treated at home. Obviously, oral medication. For those who are at risk of respiratory problems, we are sending remote monitoring devices to their homes. I think we checked last week, we'd sent out about 27,000 of these now to monitor people's respiratory patterns and their pulse oximetry, their saturation in their homes. And for some people that are getting more ill, we are delivering oxygen at home and doing remote care at home under the supervision of these doctors. So the good advice is start with your family practitioner without a doubt.
But that 20% of the 250,000 members who are infected having to go to hospital sounds very high.
It's actually in line with all the international statistics. And you must remember that different populations have different average ages. On average, we have quite a young average age. So in societies, communities like the United Kingdom, where the average age is materially higher, they actually have higher admission rates than that 20%. But we've had 46,454, just approaching 50,000 members admitted to hospital for COVID-19 since the start of the South African epidemic.
Have the vaccines made any difference? yet.
Yes, Alec, good news that the vaccines are making a difference already. It's very early. And so I must caveat whatever data I provide you by saying that this is very early data. The mass vaccination campaign of the over 60-year-olds began on the 17th of May, and we approach the 6-week horizon of that this coming Monday, next week. And so far, we've only got members who've received their first dose of the vaccine. The second dose is due 42 days or 6 weeks later. And so the second dose campaign will start nationally next week. But we do have 110,000 Discovery Health members who have had that first dose. And for those that were vaccinated more than 21 days ago, so 21 days and more, we are seeing quite positive indicators on all levels. Firstly, the incidence of new infections that they experience is 34% lower than the unvaccinated similarly aged group, 34% lower. The rate of admissions to hospital for those who are diagnosed COVID-19 positive is 48% lower.
Wow.
So
that's huge.
It's material.
Half the chance, basically.
And these are statistically significant figures because they're based on 110,000 vaccinated members. And importantly, to date, we haven't had a single death in this vaccinated group, relative to, unfortunately and tragically, quite a large number of deaths in the similarly aged population in the unvaccinated cohort. So whichever level you're measuring it at the moment, infections, hospital admissions, deaths, so, infectivity, morbidity, and mortality, we're seeing a favorable early outcome of vaccination.
The whole Gauteng wave, which, as we started off this conversation, seems to be just engulfing the province. Are you still of the opinion that it's going to be another couple of weeks at least before it peaks?
I don't know when it peaks, and we've got various projections. When I spoke to you last, we predicted a peak towards the first week or so of July. That's fortunately now only 10 days away, 10 days to 2 weeks away, and I'm very much hoping we're right. I'm very much hoping that by then it has peaked. Unfortunately, the daily escalations have been enormous, and the healthcare system will be overrun if we sustain these continued daily escalations. My only plea is that people amend their behavior and take heed and stay home.
And really, really be serious about it now, because it's never been this bad in the province anyway.
Yeah, and Alec, unfortunately, all these months later, there still are people out there who, call this the flu and deny the disease. But more and more of us are having close friends and family sadly impacted, landing up incredibly ill. And, I think this is proving to all of us how dangerous this disease is.
Ryan, just to close off with, if you are COVID positive and you've gone for your test and it tells you, say, day 4, just for argument's sake, how long is it likely that you're going to be sick for? Are there any cycles that this virus works in?
Most of the people have symptom relief after 7 to 10 days, the majority. And the majority of people who require a hospital admission have that hospital admission between 9 and 14 days. And so that's what we're seeing in our data as the natural cycle of the disease. That's at population level. We had an old saying in medicine, patients don't read textbooks. And so there are obviously exceptions and outliers. And so not everybody will respond that way, but certainly for the majority of the population, that's what we're seeing.
So the critical time for anyone who is positive is from day 9 to 14. It's either going to be an improvement in your conditions or to this degree that you might have to go to hospital.
Yes, absolutely. And take good advice and get good care from a family practitioner to make sure you make prudent decisions.
Thank you, Ryan. That was just smashing, as always. Much appreciated. And I know you've had I can imagine what kind of days you're having. So appreciate your time. I'll send you through the links and everything else when it's done.
Thanks so much. Thanks, Alec.
Cool. Okay.
Cheers.
Bye-bye.